Evening. My name is Taiwo Adeniran. I'm here again this evening to perform a neurologic assessment on my patient. I'm going to meet my patient in the room right now. Good evening.
Good evening.
Okay, my name is Taiwo. I'm going to be your nurse today. I'm a nurse practitioner, FMP student from United States University. So this evening, I'm here to perform a neurologic assessment on you. What that means is I'm going to be assessing your cranial nerves. I'm going to be also checking your muscle tone, muscle strength, and also to check your reflexes. Okay. How are you doing?
I'm doing good.
Okay, so to perform this examination, are you giving me a consent to go ahead and do it?
Yes, I do.
All right. So, and also to let you know that the video is being recorded and it's going to be uploaded on YouTube for teaching purposes. Are you giving consent to do that?
Yes, I do.
All right, great. So, before we begin, I'm going to just wash my hands right quick. Okay, so I've washed my hands and back to the examination. So I have some tools that I'm going to be using. Here I have my otoscope. I have my tongue blade or tongue depressor. I have my cotton ball. I also have my speculum that I'm going to use with the otoscope. And I have my flashlight. I also have my tonic fork that I'm going to be using for air um, conduction and bone conduction hearing test. All right, so also I have my Senate chart. We're going to be using that for your vision tests, and also I have some things for you to smell. So now, to looking at my patient, the overall is very alert, is very awake, is very coherent with the little conversation I've had with him so far, and also he appeared well groomed and well kept, and I don't see any acute distress. Okay, Sam, I'm going to be asking you some few questions, and as we go along, so can you tell me your name again?
My name is Sam.
Okay, Sam. Oh, good, good. And what city do you live?
I live in Homewood.
Homewood. Okay. So who is our current president?
Our current president is Joe Biden.
Okay, Joe Biden. All right, good. And also, I'm going to also make a sentence, and I just want to see how your speech is. I'm going to make a sentence, and you say the way I said it. Okay. I will go to school tomorrow.
I will go to school tomorrow.
Say that again.
I will go to school tomorrow.
All right, so my patient speech is very clear. There's no dysphagia and there's no any evidence of slowness in his speech at all. All right, so then I'm going to be assessing again your recent memory and also your remote memory. So, for your recent memory, can you tell me what is going on in the news now?
What is going on in the news now is Russia invasion of Ukraine.
All right, great. So Russia invasion of Ukraine, that is a great one. And also to access your remote memory, can you tell me who is the first president of the United States?
The first president of the United States is George Washington.
George Washington. Great, 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 great. That's good. So then another thing I'm going to assess is this is about judgment. I want to see how you can reason with this little situation. So the situation is you are going out of your house, maybe you are going to school, and then along the way, you're midway to school, you find a well-addressed envelope and it's stamped, it belong to someone else. You find the envelope on the floor. What are you going to do with it?
Since it is not my envelope, I would pick it up and put it in the nearest mailbox.
All right. Can you speak more louder a little bit?
Yes.
Okay.
Since it was not my envelope,
Mhm.
I would pick it up and put it in the nearest mailbox.
All right, right. So great judgment, great judgment. So my patient reasoning and judgment is very intact. So the next thing we're going to do now is to assess your cranial nerves. So we have 12 cranial nerves that we're going to be assessing, and the first one is cranial nerve number one, olfactory. Olfactory is about your sense of smell and how to assess that through your nursery. I'm going to have you close your eyes. Okay, so and I'm going to have you close one nose Then the other nose, you're going to tell me what you smell. What do you smell?
Vanilla.
Huh?
Actually, cinnamon. I'm sorry, cinnamon.
Cinnamon.
Yes.
Okay, so this one is made of cinnamon. Okay, good, good. All right. So then, can you close your eyes again? Block the your right nose. Okay, on your left nose, what do you smell?
Vanilla.
Vanilla. So this is made of vanilla scent. Okay. All right. So or its olfactory sense is intact. So the next one is optic nerves. So to access my patient optic nerve, which is cranial nerve number 2, I'm going to use my ophthalmoscope just to. All right, so I'm going to use this just to um, see how your eyes constrict to light, and I'm going to also check into your pupils, check your red reflexes. Okay. Okay. All right. So I'm going to go from my right eye to your right eye. Okay. And it constrict to light, and then also my left eye to your left eye. Okay. The red reflex present. Then also using the flashlight. Go from so what I'm checking here, um, to check for direct um, constriction to light, and also um, direct is when the right eye constrict as I fly to the right eye, and at the same time also I'm also checking for consensual as I flash light to his right eye, the left eye also constrict. That's consensual. So, and in addition to that, we are going to be checking cranial nerves number 3, oculomotor, cranial nerves number 4, trochlear, and also cranial nerve number 6, abducens. Those are for your extraocular activities to see how your eyes can move and roll. So I'm going to have you look straight, and you don't turn your head, you just turn your eyes as I move this pen light. All right, so the six visual gaze is intact. So then also we're going to check for visual acuity. So I'm going to have you close your right eye. Okay, so you're going to tell me how many fingers you see.
4,
Okay.
2, 2, 1,
All right, so let's do on the left eye.
4, 6, 2.
All right, so visual acuity is intact. So Another thing to check for your vision or your visual acuity is to use the standard chart, and you're gonna I'm maybe 6 feet away from you. You're gonna close your right eye, and you read from the last number. You tell me what you see.
LTFPH.
LTFPH. Great. So acuity OD is 20/20, and let's do the left eye.
DHJBS.
Okay. Acuity also on the left eye is 20/20. All right, great, great. So part of the extraocular activities movement of your eye, okay, is I want you to look. No, you don't turn your head. Just look to this side. All right, this side. Okay, then up. All right, good. All right, so then the next cranial nerve to check for is cranial nerve number 5, trigemina. So trigemina is also will test for your motor function and also your sensory function. To test for motor function is going to check your temporal mandibular joint movement right here. I want you to make your chin tight, okay, then open. All right, so the temporal mandibular joint, there's no cracking, there's no um, abnormal movement, and I can also see the mastoid bone right here. Okay, so then I want you to um, open your mouth and try to open your mouth against resistance. All right, so it's able to do that without any problem. So part of the sensory of the trigemina is also, the temporal pulse right here, and also you tell me where I touch part of your of face. Okay, close your eyes.
Forehead, nose, right cheek, left cheek,
I want you to speak louder.
chin,
Okay.
left cheek, right cheek.
All right, good, good. So this trigeminal sensory cranial nerve number 5 is intact. So the next one is to check cranial nerve number 7, facial. So with facial, I want you to uh, make a smiling face for me. Okay, make a frowny face for me. All right. Can you pop out your cheeks? Okay, good. So facial nerves, cranial nerve number 7 is also intact. So the next one is cranial nerve number 8, festo festo cochlea. So this festo cochlea or acoustic nerve is to check, the hearing and balance of my patient. So I'm going to do the hearing just now. The balance will be also done as I go in further in this assessment. So now, to check for the hearing, I want you to, I'm going to whisper one or two words into your ear, and you're going to close one ear, all right? So to your right ear, I'm going to whisper a word, and you tell me what I said.
Blue ball.
Okay, good. All right. So then, uh, cl- close your right ear. So I'm going to whisper another word into your left ear. You tell me what I said.
Apple and banana.
All right, good. So there is no hearing loss. My patient is able to hear from both ears. So part of checking for the hearing is to do the Weber test. So with the tuning fork, I'm gonna have this on your forehead. You tell me if you hear the ringing sound on both ears.
Yes.
Okay. All right. Good. All right. So then the another one is Renick test. Okay. With the Renick test, we're gonna check for bone conduction and air conduction on both sides. So you tell me when you don't hear it anymore.
I don't hear it anymore.
Okay. Or you see here? Yeah.
Yes, I do.
Okay. So this is the normal assessment. The air conduction is greater than the bone conduction. That is why you are able to hear it more in the frontal part of your ear than the mystoid bone at the back of your ear. So let's do the other side. Tell me when you don't hear anymore.
I don't hear anymore. I still hear it.
Okay, good. So the air conduction on both ears are greater than the bone conduction. All right. So the next cranial nerve is going to test for is cranial nerve number 9, glossopharyngeal nerve. Glossopharyngeal nerve is the cranial nerve that helps you to swallow and have a gag reflex. So I'm going to have you swallow, okay, and also I'm going to have you open your mouth wide. Open your mouth wide. Okay. So part of it, I'm looking at the uvula, which is also at the midline. It's not bulging, and also is a hard palate and soft palate are pink and moist. All right. So I'm gonna put this tongue depressor on your mouth just to check for your gag reflex. All right, good. So my patient has a very good reflex, which show that cranial nerve number 9, glossopharyngeal, is intact. The next one is cranial nerve number 10, vagus. With vagus, cranial nerve also help patient in swallowing and also in speech. So my patient has been talking to me ever since we started this examination. There is no hoarseness in his voice and is able to swallow. So cranial nerve number 10 is also intact. So then the next one is cranial nerve number 11, accessory nerves. So for accessory nerves are nerves that will help you, move your shoulder, move your neck, with no problem. So I'm going to have you, you know, uh, as I press down your shoulder, you move it up against resistance. All right, good. Then your neck to the left side, move it to the against resistance. All right. Then to the right side. Okay. All right. So patient cranial nerve number 11, accessory nerves intact. So the last one in cranial nerves is number uh, 12, hypoglossal. Hypoglossal is to check, that your tongue is able to move your tongue. Is at the midline with no problem. So I'm going to have you again stick out your tongue. So I'm assessing the tongue. The tongue is at midline. It doesn't deviate. There's no deviation to the right or to the left. So, and with the use of my tongue depressor, I'm able to look. So there is no bulginess of the tongue, and also uh, is able to move his tongue with no problem. So cranial nerve number 12, hypoglossal, is also intact. So that completes the cranial nerve session of this examination. The next one is going to go to muscle coordination. So with the muscle coordination, I want to assess the gaits of this patient. I want to assess how the patient move and with no problem if the gait is steady or unsteady. So I'm going to have you stand, okay? So part of it is to look at his posture. There is no deviation. There is no spinal curvature. And can you take a few steps for me? All right, good. Okay, come back. So his gait is not his gait is steady, and there's no. So now one of the things to test for your muscle coordination is to have you take a tandem walk. Okay, tandem walk is going to be you're going to on a straight line, your your feet your heel to your foot on a straight line. Take a few walk for me. All right. Okay, come back. All right, so he's able to take the tandem walk with no difficulty. There is no unsteadiness in his gait, and his posture is also normal. Then also, I'm going to have you take another walk. This one, you're going to walk on your toes. All right. Okay. All right. So he's able to walk on his toe also, and his gait is also still steady. Then I'm going to also have you to walk on your heels. On your heels now. All right. Patient is able to walk on his heels with uh, no unsteadiness. So and is able to do that. So part of the coordination also is to do a test called Rombach test. With Rombach test, okay, I'm going to have you as you stand. I'm going to have you extend your arms. Okay, close your eyes. All right. Oh no, extend your arm like this. Oh, okay. Then close your eyes. So I'm assessing also if there is any jerkiness, if there is any instability in his gait, and I don't see any of that. So his posture is steady. Good, good. So the pronator drift test. With the pronator drift test, I'm going to have be in that position. You extend your arms, and I will try to pull your arms down and see how you can adjust with that. All right. So with the pronator drift test, okay, good. So he's able to maintain his hands in extended position with no drift. Okay, good. All right. So so that's the pronator drift test. So we're going to go to the next one, which I'm going to have you take a seat. So this one is called rapid alternating test. With rapid alternating test, okay, I'm going to demonstrate it to you. You're going to do it faster, okay, this way, and I want you to see how you can do it. Close your eyes tight. Okay, now let's go. All right, all right. I need to adjust the camera so we can see that. I need to adjust the camera. All right. Every test must be shown. Okay, do the rapid alternating test one more time. Okay, good. So the next one is a finger to nose test. Okay, so you're gonna close your eyes and you're gonna I'm gonna have you touch my finger, and that finger you used to touch my finger, you used to touch back to your nose. Okay, all right. Let's do it. Look at my finger here. You touch it, then you touch your nose. Okay, let's go. Close your eyes. Okay, so he's able to also do that. There is no uh, deviation or jerkiness in his finger. So the next one is we're going to go into sensory or sensation test. So with this one, I'm going to perform a test called joint position test. With the joint position test, you're going to tell me, or as you close your eyes, you're going to tell me where I touch in your body. You're going to tell me where I touch in your body as you close your eyes. Okay? You ready? All right, close your eyes.
My knee.
What kind of knee? Right or left?
Left knee. Left knee. Right shoulder. Right wrist. Left shoulder. Right and left thighs.
Okay, good. So with the jump position test, is able to also perform that with no difficulty. So the next one is 2-point discrimination. With the 2-point discrimination, so I'm going to have um, some a sharp object like a paper clip here, and you tell me if I punch you, if you feel 2 point uh, touch or just 1 point touch. Okay, all right, so you ready? So this is a 2-point discrimination. So you're going to tell me if it's 2 touch you feel or just 1.
One.
Hmm?
1. 2. 1. 1. 1. 1. 1. 1. 1. 2. 2. 1. 1.
Okay, so Uh, 2-point discrimination is also intact, so it's able to differentiate between 1 point and 2-point touches. So the next one is stereognosis. So stereognosis is to check how the patient able to feel and identify. I'm able to feel and identify. I'm going to put an object in his hand as he closes his eyes, and he will tell me uh, what's the name of that object. Okay, close your eyes for me. Okay, so you tell me what I've put in your hand.
A pen.
A pen. Okay, so this is a pen. All right, so let's do on the other side. Close your eyes.
Gloves.
Okay, gloves. All right, good. So the stereognosis is also intact. So then the next one is graphatasia. Graphatasia is graph like withdraw tertia. Then you will be able to know. So I'm going to draw something in your hands, and you tell me what I've drawn as you close your eyes. Okay. What did I draw?
Could you do it again? Uh, like a X on three, like an X, but on 3 sides.
Okay, let's do it again. What did I draw?
A dollar sign. S.
Okay, S.
B.
Okay, B.
a slant.
Okay, let's do this one.
0.
Okay,
12.
good. All right, so his gravitation is also intact, so is able to identify what I drew in his hand. All right, so the next one is extinction. With the extinction, you'll be able to identify um, the the areas I've touched or differentiate uh, the areas that I've touched in your body. So you're gonna locate them for me, okay? As you close your eyes.
Left shoulder. Right. Like near the elbow.
Okay.
Right ankle. Left knee. Left and right ankle.
Okay, good. All right. So that is also intact. So the extension is also intact. So then we're gonna do so part of the sensory is to do the sensation of your upper extremities, okay, and we're also going to do deep or painful sensation of the upper and lower extremities, light sensation of the upper extremities, and we'll do it vice versa. Okay, can you take off your clothes for me? All right. Okay, so you close your eyes. So you're going to tell me if it's dull or sharp.
Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull.
All right, so it's um, sensation for light sensational touches and also painful sensational touches on upper and lower extremities are intact with no problem. Okay, so let's do the next one. Let's do the next one, which is going to be. I think the next one is going to be. We've done upper and lower extremities. We're going to go into motor system. Okay, to access for motor system is also part of uh, you know uh, comparing the muscle strength and muscle tone on both sides. So I want to compare the muscle strength and muscle tone on each side. Okay, so now what I want you to do is I want you so to make a fist, okay, and I will try to break this fist so you won't don't let me break it, okay? All right, good. All right, so then so you lift up your hand. So you're going to press down as I'm trying to push your hand up. Okay, good. All right. So then as I'm trying to push your hands down, you're going to push up. Okay. Don't let me push you down. All right. Okay. So then with your uh, bicep muscle, so uh, I'm trying to push, flex your arm. Don't let me. I mean, extend your arm. Don't let me. On the right side, then on the left side. Okay, good. All right. So here I want to take, this is abduction. So you try to bring it back to your body as we try to do this. Okay, good. Then adduction, as I'm trying to put your arms in. Okay, good. All right, good, good. All right. So I want you to um uh don't let me. I'm trying to pull you, so you try to pull me back. All right, good. All right, so his muscle strength is 5 on 5, and everything on both sides. The hand grip, the finger strength, and also the deltoid and the tricep and bicep muscles are intact, and the strength 5 on 5 on both sides. So we're gonna look at the lower extremities. Okay, with the lower extremities. So I'm trying to push you in, so you don't let me. Your right, your right. I mean your left. Okay. Then yeah. Okay. As I'm trying to lift you up, you try to work against what I'm doing. Good job. All right. So let's do the plantar flexion and the dorsal flexion of your foot. Okay. So you try to push it up, and then okay, this one. Okay. That's good. That's good. All right. So then I think we've done with that. So the last and the final one in this neurologic examination is we call the deep tendon reflexes. So we're going to be checking for about 5, 6 tendon reflexes. The first one is brachioradialis. So with brachioradialis, where's my where's my okay. With brachioradialis, I'm coming to your wrist on the left side, right just above the notch. Then gonna just a little tap on your uh, radialis tendons. Okay. Okay, good. You can see the reflex there. Then for the brachial, okay. So the brachial, I come by the brachial muscle right by the fossa. Then just a little. Okay, you can see the reflex right there. Then let's do the left tricep. Okay, the left tricep. Okay, come just right above your left elbow. All right. Okay, good. So you can see that. Let's do the right side. Brachioradialis. Okay, good. Good reflexes. It's 2 plus on the left side. Also, the right brachioradialis is 2 plus. Then the right brachial is also 2 plus. The right the right triceps is, let's check the right tricep now. Okay, move your hand. Okay, good. It's also 2 plus. There's no clonus, there's no hypotonic reflex, so 2 plus is normal. So then we're gonna go to the patella. So the patella is right there by L2, between L2 and L4, below the kneecap. Okay. All right, good reflex. All right, then the left patella. All right, good. So then I'm gonna do that one is 2 plus as well. We're gonna do the Achilles. So the Achilles, I want you to lay down. So the Achilles is right just by your behind your ankle, and then we're gonna do the left Achilles first. Okay, let me support your hand. All right. Then that one is 2 plus as well. Then the all right. So it's 2 plus as well. So then The next one we're gonna do is which is gonna be the last part of it, cutaneous reflexes. So I'm gonna have my patient lay on your back for me. With the cutaneous reflexes, I have to lay on your back, leg straight. So we have to show his abdominal muscle, and I'm going to give you a little privacy here.
Thank you, sir.
So I will have you to lift up your clothes so we can see your abdominal muscle. So with the cutaneous, we're going to do the abdominal one, which is abdominal cutaneous reflex. I'm going to just provide like a tactile stimulation into the abdominalis muscle, and so you can see the reflexes here. Okay, so and that one is 2 plus as well. Then the last and the final one is the plantar reflex or the Babinski reflex. Okay, with the Babinski reflex, we want to check for that. So in normal adults like my patient, the reflex, there will be a plantar flexion of the reflex that which is normal. So that but in a child, so there will be a flare of their toes. All right. So I'm going to use the edge of my armor to just provide a little tactile from just right below your heels. Oh yeah, so we can see there's a plantar flexion of his left toes. Okay, then let's do the right toes. All right, there's a plantar flexion, so which is normal for his age group. So I believe we've covered all the parts of this neurologic examination. And I want to thank my patient for his patience and his time, and I hope to see him next time. Thank you.
Thank you, sir.
All right.
Thank you.